Scratching your eye can be a very painful experience, and depending on the size of the scratch and what scratches your eye can make it very serious. So in this video, I'm going to go over what a corneal abrasion is, what it does to your eye, and ultimately what you should do if you scratch your eye. Let's focus in. Hey, howdy everybody, this is Dr. Neil Guymon, Dr. Eye Guy, with the channel that keeps your eyes healthy and your vision clear. Now, there are many different ways you can give yourself a corneal abrasion. You can scratch your eye with your own fingernail or your kid's fingernail. You can poke yourself with a pen or your makeup. You can get a cat scratch or scratch it from a chipped contact lens or a scratch from a foreign body like a piece of metal or wood shavings or a speck of dust. Also from a tree branch or pine needles or a plant or other vegetation, or even from a paper cut. Yeah. Now let's talk over some of the symptoms that you might experience when you have a corneal abrasion or an eye scratch. The obvious one being pain, and we're talking significant pain and irritation. Will make you want to cry type of pain. A lot of times when people have an eye scratch, it will have a foreign body sensation. It will actually feel like there's something in there. In fact, we see this in the clinic all the time. People will come in thinking that they actually have something in their eye, will look everywhere, nothing in the eye, but they have a big corneal abrasion, and it makes it feel like there's actually something in the eye. You'll also have tearing because the eye will want to flush and coat the eye with fresh tears. You may also experience a headache or a brow ache or an eye ache. Another common one, especially if you have inflammation on the inside of the eye, is that you'll have light sensitivity. Your eye will actually hurt when you go outside or you're around some bright light. And also, depending on where the corneal abrasion is, if it's near the central visual axis or if you have a lot of swelling, edema from the corneal abrasion, then you might also experience blurry vision. Now let's go over what actually happens when you get a corneal abrasion. Now the cornea is a clear dome right on the front of the eye that covers the iris and the pupil, and it's made up of a bunch of different layers. Now the outermost layer of the cornea is called the epithelial layer, and it's the area that's exposed to the air and your eyelid, and that's usually the layer that gets scratched. Now what's really interesting about the cornea is that there are a lot of nerves. In fact, more nerves per area than really anywhere else in the body. So if you scratch the cornea, you get a corneal abrasion, you expose those nerves and can be really irritating and really painful. But what's also really interesting about the cornea is that it can heal really fast. Depending on the size of the scratch, a lot of times corneal abrasions can heal in 1 to 2 days, way faster than a scratch on your skin. Also, what's super nice is that if you just scratch the epithelial layer, it doesn't leave a scar. In fact, you probably won't have any visible evidence that you even had a scratch to begin with. Now that's the good news. There are a few things to be aware of with corneal abrasions. If the scratch goes deeper into the cornea, crosses Bowman's layer, then it can leave a scar. And if you scratch it big enough, or if you scratch it in the middle of the pupil, in the central visual axis, then it could scar and it could potentially permanently cause reduced vision. Another important thing is to know exactly what scratched your eye. If there's a possibility that bacteria was introduced, it could lead to a bacterial infection, or even worse, if there's the possibility that fungus was introduced either from a plant scratch or other vegetation, then it could lead to a fungal infection, which can be very serious for the cornea. Now this leads me to talk about the treatment of a corneal abrasion. Like I said, the cornea can heal really fast, and it heals really well, can heal on its own. If it's mild and a top level surface scratch, a lot of times all you need is artificial tears to coat the eye and speed up healing time. If it's a little bit bigger and deeper scratch, you might need an ointment for a little bit longer and thicker coverage. Now sometimes your doctor will actually use a bandage contact lens. We can use contact lenses and actually put it on the cornea. This will shield that scratch from the eyelid or from the air. It will help with the comfort level and also help with healing time as well. And sometimes when the pain is bad enough, you can be prescribed pain medication, oral pain pills, but a lot of times the oral pain pills doesn't target the cornea that well, and so efficacy is a little questionable there. Just really quick, if you're finding value from this kind of content, definitely hit that like button for me. Thanks. If people have an eye scratch, usually I tell people to go see your eye doctor to get the proper treatment. Sometimes you might need a steroid eye drop to help reduce inflammation. You might need an antibiotic if there is risk that bacteria was introduced into the eye, or an antibiotic eye drop just for prevention's sake. The eye doctor will know when and what to prescribe. Now, if you scratch your eye, what are the first steps that you need to do? Now, first things first, don't rub your eye, especially if you suspect something flew in your eye, if you have a foreign body in your eye. If you go and rub your eye, you could be digging that foreign body into your eye, making the scratch even deeper or scratching more surface area of the eye. So remember, don't rub your eye. Now, it is okay to blink. Careful blinking can help flush the foreign body out. It can get the tears flowing and help coat that scratch a little bit better. So blinking is okay, just be careful. I do recommend rinsing the eye out, especially if you have a foreign body in there. Rinsing the eye out can help flush that foreign body out. One of the temptations will be to constantly pick at your eye, or sometimes people will take a Q-tip and rub on the surface of the eyeball or underneath the eyelid, and sometimes that can actually do more harm than good. It can actually damage the eyes, and if you're constantly picking and rubbing at it, sometimes that can actually cause an eye infection more from your hands and introducing something into the eye and not actually the scratch itself. Now, for sure, once you've rinsed your eye, even if you feel like you got the foreign body out of your eye, still call and go to your local eye care provider. They can see exactly if you have that foreign body out of the eye and also check the cornea or the eye to see how bad the abrasion was. If you're feeling light sensitive, you can definitely wear sunglasses to help with that. Definitely don't wear your contacts if you feel like you have a corneal abrasion or if you feel like there's a foreign body in there. Just stay away from the contacts until your eye is completely healed. Another temptation will be to use the redness relief eye drops to get the red out of your eyes, because your eyes will likely be red, but don't use the get the red out eye drops. That actually can delay the healing a little bit, and sometimes it can be painful to put that eye drop in your eye. Now, one thing about corneal abrasions is that they can turn into recurrent corneal erosions. And this is when that baby soft tissue doesn't adhere to the cornea very well and can actually be re-ripped time and time again. This usually happens when people wake up from sleeping. Now, I'll have a full video about that. I'll put it right there when it's ready. If it's not there, definitely check out my other videos. Make sure you're subscribed. I'm Dr. Neil Guymon, Dr. Eye Guy. Stay focused.